Hello and welcome to another episode of More in Health. This video will be about best practices for managing patients within a long-term care / skilled nursing facility. It is Friday evening and I have just completed going through several pieces of information related to my patients' labs and previous visits with other specialty practice providers. As the primary care provider, managing over 50% of patients within what is considered a large facility, that's usually a facility that has about 150 to 175 beds. We average about 118, 120 patients, and I have about a little bit over 50% of those patients. Half of my patients are long-term care, and the other half of my patients are skilled care patients, and that means that they're here post-op various surgical procedures or became deconditioned due to pneumonia or just failure to thrive due to age and a long list of chronic illnesses. I find it extremely important that although the patient is within a long-term care / skilled nursing facility, it is imperative to keep the lines of communication open. Patients will find themselves needing to see their specialty practice provider, the pulmonologist, the endocrinologist, the gastroenterologist, the cardiologist, infectious disease. It is pertinent that you receive a progress note from these providers so that you can have a clear understanding on what their perspective for the plan of care related to that disease process, so that there's no gaps of delivery of treatment for your patient, and it allows for them to continue to have an optimal level of health while they're here long-term wise, or to help transitioning them back into the community to be as seamless as possible. You'd be surprised that because of the latest use of advanced technology, a lot of the paperwork that comes back with the patients from these visits will be a generic summary. Today you were visited by this provider and your vital signs were done and we ordered said labs. If you have any worsening conditions, dial 911 or return to your emergency room. Follow up in 6 to 8 weeks. That's like your generic, you've been seen type of discharge paperwork. No, what you really need is the progress note. So a lot of times, just like myself, I'm very busy. Sitting down to write the notes will take some time, but make sure that you follow up and you request that progress note from your patient, because that allows you to have a paper trail to know exactly what that other provider is thinking and what they assess on how and why the plan of care either needs to remain the same or needs to be changed. So I hope that information was helpful to you. Stay tuned for more episodes of More in Health.